I waited a while. I was in college and I started having to go to like the ER because I was in so much pain and no one was really taking me seriously. And my dad was like, you have to go to the OBGYN. So I finally went to the OBGYN and they thought I had endometriosis. And after a diagnostic laparoscopic surgery, they found nothing to really understand why I was in the pain I was in. They would just take me in, give me a pregnancy test, and then send me on my way with some narcotics. So no one really had the answers to why I was experiencing this much pain.
She's a lot like many of the incredible women that I meet. Here is this amazing, high energy, 25-year-old woman who comes in and starts off in the front desk in our office, ends up becoming an assistant office manager, has learned so much in the last year or two and done so much, and to find out that she's been, in horrible pain for a long time is really surprising. I think it speaks to the incredible strength of women who endure so much.
And I started scheduling these patients with the same symptoms that I was experiencing that I didn't want to talk about because in the past, people didn't take me seriously. My legs go to sleep. My feet are always asleep when I'm sitting down. My left leg goes on fire every once in a while and I don't really know why. My pelvic pain is extremely painful. I would say like a 12 out of 10. And the pain was really bad around my periods. It really just affected every kind of part of my life.
So I was really grateful that she trusted me enough to share this with me, and we went ahead and ordered the MRI. And indeed she does have a fairly severe narrowing of that iliac vein. So as we come down, we can see the spine here in the middle. The artery starts to split first. So we have a right and a left iliac artery. And as that right iliac artery crosses across the body to go down to the right leg, where the vein comes up underneath, there's a severe compression in Katie. If we stop and look here for a second, we can see the right vein and the left vein, and it's almost imperceptible where that vein goes under the artery. As we come down a little lower in the pelvis and the vein is on either side of the spine, on each side of the body now, we can see the veins are nice and round or oval and wide open. But if we look back up again and follow that vein, we can see that as it comes across the spine and goes under the artery, there's a severe pinch right there that causes that narrowing and forces the blood flow to go through other veins in the pelvis.
And then that night she read the MRV and told me, you have severe Thurner. And I just remember like crying because I finally had an answer.
So Katie came in for her procedure. She did great. Basically what we do is we take her in the room and then she gets put to sleep. It's not really all the way to sleep. It's called monitored anesthesia care. And so she's not really just in a twilight zone, but doesn't remember anything, but is breathing on her own and maintaining her own blood pressure and heart rate. So we put some numbing medicine in, put a tiny needle into the vein and a little wire that allows us to put in a device we call a sheath. So we place a small wire all the way up near the heart. And then we take a picture in the pelvis, and what we could see in Katie is that there was blood flow up through the veins in the pelvis, but that the blood flow went around a compression of that iliac vein at the top into veins around the spine and back down into the pelvis, across the pelvis into the other side, confirming that there was a physiologic compression and not just a mild compression that maybe wasn't causing symptoms. Then we select the correct stent size. We're able to place that into the vein and we immediately watch that vein open. We use a balloon to put the stent in place and stretch that out a little bit, and then we just repeat the X-ray dye test or venogram and we watch the blood flow through the stent rather than around the stent and through all these veins in the pelvis. And then to confirm that, we take the intravascular ultrasound probe again and do an ultrasound on the inside of the vein, and we see that that compressed vein is now turned around and is held open by the stent. And then we can see the stent is well placed. And then we take everything out, hold pressure at the groin where the access site, and because the vein is elastic, it'll close on its own. And then Katie just had to recover in the recovery room with some pain medication and wake up a little bit until she was able to get up and go home.
I'm feeling like a new person. I feel like I finally have the energy to do the things that I want to do and I don't have to take a nap every day, which is a weird concept. And like right after the procedure, when I was going home, I could feel my legs and my feet
She did incredibly well. Some people have pain out to 3 weeks, slowly improving over time, but Katie was back to work in about 4 or 5 days.
I'm looking forward to going back to school and going into medicine so I could treat people and give them this liberating life that I have now. My dad would probably just be so happy. He was always my biggest advocate, and he would be the one to find any doctor that would possibly have an answer to what is going on with me. But I know he had a hand in this, in finding me this practice to work for and finding me Dr. Spencer, and I know he's smiling down.